Board of Directors. Today's meeting is officially called to order. For the record, please note that Erin Kelly is representing Deputy Mayor Susan Miles Gustav. Karen Sanhelier is representing Molly Wasso Park. And Dr. Zahira Magnat is representing Dr. Michelle Morse, all in a voting capacity. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on April 24th, 2025. Are there any questions or changes? Can I hear a motion to accept the minutes?
So moved.
All in favor, please say yes.
Yes.
Both say no. So minutes accepted. During the executive session, the board received and approved oral and written governing body report from NYC Health and Hospitals Jacobi and NCB. The board also received and approved the written submission of the semi-annual governing body reports from NYC Health and Hospitals Lincoln and South Brooklyn Health. The board also received and approved semi-annual governing body 2024 performance improvement and evaluation plan written submission from NYC Health and Hospitals Guinier, Gotham Center. So Dr. Wright and Dr. Espiritu, thank you for visiting the Harlem Hospital and meeting with the hospital staff and leadership. We'd like to provide any feedback.
It was a great visit. I really enjoyed it. We had a great tour of the behavioral health facilities and the pediatrics floor, and enjoyed a warm welcome at a party for the nurses at the end of the day. So it was a lot of fun. I was really impressed with all the work that you're doing there, and thank you for having us.
Thank you for the update and the feedback. And then on behalf of the board, I would like to thank Sally Hernandez Piñero for participating in the Joint Commission Leadership Session at Jacobi NCB. Ms. Piñero, would you like to provide some feedback?
Thank you. It was a wonderful experience. You know, it's so great that you have an opportunity to speak to someone about the relationship between the hospital's CEO and staff and H&H. And I think it's unusual to have the closeness of the relationship that we have. I think they were very surprised at how involved we are and how knowledgeable we are about what's going on and how much support we provide to the hospitals. So it was a wonderful opportunity. I was grateful to be able to do it.
That's wonderful to hear. And there may be other visits, Sally, so there will be other visits, so be ready. Please, in terms of public meetings, please mark your calendars for the upcoming Board of Directors annual public meetings for fiscal year 2025. The last in the series of 5 borough meetings will begin at 6 p.m. and it'll be Staten Island. It'll be Tuesday, June 17th at Seaview. Tuesday, June 17th at Seaview. So look forward to seeing as many of you as possible there. So let's move on to the resolutions. So it would be item number 6, action item, and it's authorizing New York City Health and Hospitals Corporation to execute a design-build contract with Bar & Bar, Inc. to undertake the renovation and construction of the RISE Recovery Integrated Support Empowerment Center at NYC Health and Hospitals Lincoln for a contract amount of $11,183,855 with a 10% project contingency of $1,119,386 to bring the total cost not to exceed $12,302,241 for a duration of 36 months. And this was presented to the Capital Committee on May 5th, 2025.
Good afternoon, board members, Dr. Pagan and Dr. Katz. I'm Manuel Sayas, VP of the Office of Facilities Development. I'm joined here with AVP Menji Indar, Senior Director Erin Egan, and our Chief Operating Officer from Lincoln, Michael Rawlings. Michael will take us through the background, and then we'll hand it off to Menji to work us through the procurement.
So we were very much involved in the selection of this team, Bar & Bar, and the architect. The Lincoln Rise project actually will do amazing things, being able to provide a specific women's health program at Lincoln. It will also be able to provide some connectivity between the LRC, which is the other SUD programs at Lincoln. We look very forward to moving forward on this project. I believe that we will have a really good project and in the future be able to renovate a lot of space that will provide great services for our patients. Also wanted to talk to you about the importance of the LRC and what we are doing. Currently, it is at the Belvis facility. We are in the process of relocating it back to the Lincoln main campus locations, so this will now be available. The entire project includes a major demolition and construction of the sixth floor D wing. And this will collate those programs with the Lincoln Rise project. The total square footage includes about 12,600 square feet. It includes new exam rooms, a consult room, a childcare area, waiting rooms, acupuncture, clean and soiled utility rooms, as well as medication rooms, an area for administration, conference rooms, and bottom line is that this will be an amazing program for Lincoln and the patients that we serve.
So this project is being delivered via the design build methodology. So as a result, it was done to a two-stage procurement, an RFQ and an RFP. The RFQ was focused on really the vendor's qualifications and their experience with healthcare construction and being able to provide architectural services, other regulatory services related to construction. The RFP was then focused on their methodology and being able to select the most qualified and firm with the methodology to align best with our schedule and needs for the project. The RFP phase also included site walkthroughs, collaborative dialogue meetings with the vendors, and vendor presentations. And each round was scored and evaluated by an evaluation committee. Next slide. So in March of 24, CRC gave us approval to issue the RFQ to City Record. The RFQ was posted in July and sent directly to 22 vendors. 18 vendors attended the pre-proposal conference. On August of 24, statement of qualifications were due and 5 statements were received. In September, the evaluation committee, their round 1 scores for the RFQ, and 3 vendors were invited in November to the RFP process after the shortlisting. December site walkthroughs were held with each vendor, and CDMs were held with each vendor in January. 3 proposals were due or received in February of 25, and vendor presentations were held with each of the 3 vendors. And the evaluation committee submitted their final scores in the end of March, and Bar & Bar was the top scoring proposer. Next slide. So this is the RFQ substantive criteria and minimum criteria. Here we really focused on, again, the qualifications of the firm. And the evaluation committee was made up of a number of team members from OFD, along with leadership from Lincoln, central office finance, and behavioral health staff as well. Next slide. The RFP phase, we focused on the methodology of the firm, how they would deliver the project. And the evaluation committee, again, were made up of the same team members, leadership from Lincoln, UITS membership, OFD, and behavioral health staff members as well. This is the contract. So it's a design build contract, as I mentioned. The contract with the design build is for $11.1 million. There's a contingency of 10%, for a total not to exceed of approximately $12.3 million. And this project is funded with a number of different sources: funding from the borough president, funding from city capital, and funding from the New York State Assembly member Amanda Septimo and Speaker Carl Hastie. Next slide. So the contract will start in July of 2025. It's for 36 months. The base work is $11.1 million, and which does not include the 10% contingency, which will only be accessed if there's additional work besides the base contract work to deliver. Bar & Bar this is the first project for Health and Hospitals, so reference checks were conducted, and there were 2 positive checks, first being $154 million major modernization project to Maimonides Medical Center, and a $60 million capital health HUD multi-campus improvement for Anchor Health Properties. and Bar and Bar submitted a MWB utilization plan of 41.5%. This is the utilization plan as to how Bar and Bar will achieve that 41.5% and the list of their subs and the services that they will be providing for the project. And this is the resolution. Happy to take any questions.
Questions to the Rice Center? Let's take it up for a vote. All in favor, please say yes. To provide building management system preventative maintenance and repair services at various NYC Health and Hospitals facilities for a contract amount of $12,128,122.89 with a 10% project contingency on preventative maintenance portion of the contract of $548,793.41 to bring the total cost not to exceed to $12,676,916 for an initial term of 3 years with 2 one-year options to extend. And this was presented to the Capital Committee on May 5th, 2025.
Thank you, and good afternoon once again. A little bit of background regarding this agreement. This is the building management systems that are installed throughout our facilities that are used to control and monitor our building mechanicals and electrical systems. That includes our HVAC, our lighting, power systems, fire systems, and security systems, as well as our critical real-time notifications for our life safety systems, including fire dampers, pressure relationships, and humidity controls. JCI has been providing maintenance for BMS at 13 facilities. JCI has a proprietary solution at these sites. BMS was procured through a competitive RFP. The procurement was approved by CRC on June 25th of 2019, followed by the Board of Directors on December 19th of 2019. For a NTE of $15.5 million. The current project contract spend between 2019 and 2025 is approximately $13.75 million and 2.5 annually in PMs. The current maintenance contract originally expired on December 31st of 2024 and was extended.
Primarily responsible for overseeing these systems, and also we had representation from finance and EITS. Next slide. This is the contract budget. We have a base scope of preventative maintenance of about $5.4 million and repair and replacement of $5.8 million. We have an allowance for annual materials at $500,000 and software allowance of $250,000. And there's also a 10% contingency on the PM portion of the base work, which brings the total not to exceed to $12.6 million. The contract details and vendor diversity. So the contract will be for 3 base years, with 2 one-year options, renewable solely at the discretion of Health and Hospitals. The contract will be for $12.1 million, which doesn't include the 10% contingency, which again will only be accessed if we add new equipment or we have emergency services that we need beyond the work in the contract. There was a goal set of 10% since JCI is self-performing this work, and they were given a waiver. In the previous contract, they had a goal of 12%, and they exceeded it with a utilization of 16.5%. And the reason why they're not able to do that for this contract is some of the equipment under the old contract is no longer under their scope, so that was removed. So they were unable to subcontract that portion of the work out. And JCI is our current BMS vendor with a good rating.
What they were doing on,
There's less equipment. We don't have the same quantity or number of equipment for them to maintain as we did in the prior contract. We did reduce the overall inventory we transitioned away to other vendors.
right,
Yeah.
okay, so you're not under their proprietary solution for that?
Not as much as we were previously.
Right.
And we're slowly working to, as we get more funding and as opportunities become available, to shift to more open source equipment. Yeah.
So the new vendors for those other projects are open source?
Yeah,
or
those equipment that we've replaced have more vendors, more than one vendor that can support
Okay, because,
provide preventative maintenance services.
you know, there's only one proposal here, so not much of a, selection. Okay, so we're slowly shifting our inventory as we improve our rates. Thank you.
Certainly the goal.
Any other questions? Okay, let's take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much.
Thank you very much.
And number 8, Dr. Calamia.
Thank you. Approving the application of the New York City Health and Hospitals Corporation, the system for verification by the American College of Surgeons, the ACS, of the New York Health and Hospitals Harlem as a Level 2 pediatric trauma center, and committing to maintain the high standards needed to provide optimal care of all pediatric trauma patients, and that the Multidisciplinary Trauma Performance Improvement Program has the authority to evaluate care across disciplines, identify opportunities for improvement, and implement corrective actions, and authorizing the appropriate officers of the system to execute any and all documents necessary to verify Level 2 Pediatric Trauma Center designation for Harlem through the ACS Committee on Trauma. This was brought to the Medical and Professional Affairs and Information Technology Committee on May 5th, 2025, with unanimous approval to be brought to the full board.
Good afternoon. My name is Kenra Ford, Senior Vice President, Clinical Services Operations. Good afternoon, Drs. Pagan, Dr. Katz, and board members. I'd like to introduce our Harlem team.
Good afternoon. My name's George Lacone. I'm the CEO of Harlem Hospital.
My name's Art Cooper. I'm the Pediatric Trauma Medical Director at Harlem Hospital.
And we'll proceed with the overview of the resolution request. Please go ahead.
Thank you. As you can see from the slide before you, there are 6 trauma centers that's supported by Health and Hospitals, Harlem being one of them. Not all of these centers are pediatric in nature. The pediatric centers include Jacobi, Bellevue, and hopefully ourselves. And that will provide, we believe, reasonable coverage for injured pediatric kids throughout New York City. Next slide, please. We are obligated under New York State regulations to seek verification from the American College of Surgeons Committee on Trauma, which publishes every few years a document entitled Resources for Optimal Care of the Injured Patient, referred to affectionately as the Gray Book, based on the color. We are held to these standards, and we have a site visit coming up in the very near future that will demonstrate our adherence to these standards. The governing entity of that particular facility, for obvious reasons, without your support, and we're deeply grateful for the past support you've provided us, without your support, we can't meet the mission for our patients. Subtle change in this particular edition of the resources document is that there needs to be an explicit statement of the level of verification that's being sought, hence the resolution referring to level 2 pediatric trauma designation. Next, or verification, I should say. Research and scholarly activities are only required in level 1 centers. I'm very happy to say that if we met the volume requirements for a level 1 center, which we don't, none of the pediatric trauma centers in our system do, but if we did, we'd meet all the research and scholarly activity requirements as well. So we're in effect a level 1 center, but we don't have the volume to call ourselves level 1. Thank you. Next one. We do extensive professional community outreach. All trauma centers are involved in teaching the community about stopping the bleeding. It's, for those of you who are familiar with public access defibrillation, it's a similar kind of approach. It's public access hemorrhage control, if you will. It's one of the responsibilities of all level 1 centers to train the next generation. Again, even though we're level 2, we have the largest training program within the system for training. We run about 15 advanced trauma life support courses a month, or a year, excuse me. I think it'd kill us if it was every month. But we also run resuscitation programs in many other areas as well, in addition to other trauma outreach activities, particularly with the paramedics in New York City. Next slide. We have a very robust pediatric performance improvement patient safety program, affectionately known as the PIPS program, where we extensively review the quantity and quality of care that's being offered, look at all cases under a microscope. Sometimes low power is sufficient with good outcomes, but sometimes we get up to high power where we have several levels of review involved, and up to and including a peer review committee made up of all the hospital professionals involved in the care of the trauma patient. That does report through the hospital PI program, as well as the respective departmental PI programs, but it's a key component of making sure that our kids are getting the best care we can provide. Next. Operating rooms have to be available, obviously, within 15 minutes, and with the ability to open a second room if needed. We have to have the ability to manage orthopedic trauma, both in the operating room and separately as the need may arise. Blood bank, radiology. In a brief period of time, we lost our orthopedic surgical coverage, and a lot of pediatric trauma in kids is orthopedic. We've fortunately rectified that problem, and while the year that we reported to the college has only about 87 patients, we're going to be well over 100 this year now that we've been able, with your support and Mr. LeCont's, to bring on a really top-notch pediatric orthopedic trauma surgeon. So we're doing extremely well in that regard. Thank you.
If we go above 100, does that make us level 1?
No, there's no more volume requirement for level 2. You have to get above 200 to make level 1. But again, we have all the bells and whistles we need to be level 1. But we're not going to be anywhere near that 200 level, I don't believe, and nor are any of the other facilities in the system. I might say also we have an incredible injury prevention program, and when I started at Health and Hospitals 100,000 years ago, we had way more injuries than should have been there for a community of our size. But with a very robust injury prevention program that you and Mr. LeCont continue to support, thank you so much. We're doing very well, particularly violence prevention, violence interrupters, the Stopping the Bleed program. So there are all kinds of programs involved with injury prevention. So I don't anticipate that we'll get up above 100, probably in the range of 120, 125 this year. It's always a double-edged sword as a pediatric trauma surgeon. You don't want to see kids hurt, so you have to have a robust injury prevention program. But at the same time, you need to be there, when things don't go right. Sir.
Just the majority of the patients that do come in, are they coming through EMS or?
So President's report, Dr. Katz.
Okay, very good. Somewhat lengthy report, and I'm not going to attempt to read it. We were very happy to celebrate National Nurses Month at all our hospitals with this year's theme of the power of nurses. We appointed Dr. Anitha Srinivasan as the Chief Medical Officer at Metropolitan, and I think many of you have met her in other contexts. She's a breast surgeon who's been a great leader in a variety of contexts for us, a long time, more than 20-year physician at Metropolitan who really understands us and what our mission is. We have a new nurse career ladder under behavioral health, which is something we believe in very strongly, is to maintain staff by providing educational support and financial assistance in exchange for a commitment to stay with us for at least 3 years. Several of us were at Queens Hospital with the borough president to rename the hospital pavilion the Claire Shulman Pavilion. As someone who was not here during her reign, it was wonderful to hear of her support of Queens Hospital and all the things that she did to make it a great place. We've expanded dermatology services at Gotham. It's an area where there's a tremendous amount of demand among our patients. We renovated our behavioral health suite in East New York. Several of us were out to Kohler, where Mr. Hank Carter and Wheelchair Charities donated a variety of really interesting state-of-the-art rehab equipment and sort of designed for sort of full-body strengtheners that are low impact. And a very interesting machine with lithographs for someone who cannot speak, but where we watched her pressing just a few buttons, and because they're lithographs, they have a huge amount of text for each button. So she can press one button and then have, several sentences come out. It was amazing to watch. Elmhurst and Queens achieved the baby-friendly designation. Dr. Sira Madad and our CFO, Roger Zhu, were named to Asian Trailblazers list for 2025. We celebrated 25 great doctors under our annual Doctors' Day celebration. We received $2 million in investments for our nurse and nurse training. We continue to work with the Department of Veteran Services to make sure that our patients who are veterans are able to get the services they deserve. Our HERC programs are winding down, with a special thank you to Karen and to DSS for taking on, and DHS for taking on the work, recognizing that we've moved from a crisis point where the city needed to open up hundreds of beds daily to more of a steady state program. So it makes sense that it would now be part of the city's standard way of caring for new arrivals to New York City. We had an Immigrant Healthcare Day of Action, particularly important for immigrants to know that we welcome them at this time. We had super strong performance from MetroPlus Health for a lot of reasons. I think MetroPlus continues to do very well. You have the data here, but I'll just say anecdotally, when I came 7 or 8 years ago, people did not think highly of MetroPlus Health, and you heard that a lot from patients, you heard it from other providers, and that is no longer the case. I mean, people think very highly now of MetroPlus Health, and the plan has really, turned it around through the leadership, and I credit Sally with having a very active board involvement with it. It is a very different plan, both in terms of its finances and how people perceive it. We had our city budget hearing. The state enacted its budget. The federal government is attempting to pass a budget bill, which right now, what passed in the staff, on the House side, would result in several hundreds of millions of dollars of cuts to health and hospitals. In all likelihood, the size of the cut for the state is huge. We don't yet know how it will get passed on to providers like us. The Community Affairs team hosted the first system-wide Community Affairs staff recognition luncheon, which was a big success. For the record, I want to mention our contract deviations. Since the last meeting of the Board of Directors, I authorized an extension of BioReference contract through June 30, 2026, and an increase in the not-to-exceed amount by $4.8 million. The original contract was approved by the board in June 2020 with a not-to-exceed amount of $25 million through the contract expiration date of June 30, 2025. We're currently in a request for proposals process that began on January 22, 2025 to procure these services. We have a couple of license agreements that did not need to come to the board, but we, in transparency, want to alert you to them. They didn't come because they're under $5 million. The first is a license agreement with Eric Degis, DC Wellness PC, for wellness services for staff at New York City Health and Hospitals Metropolitan. The license commenced December 16, 2024. Term is for 5 years at an annual cost of $8,820 for a total of $46,826.58 based on a third-party fair market value assessment of the neighborhood. And the second license agreement is with Andes of Kings County Corp. For 2 food service retail establishments at New York City Hospital South Brooklyn Health. License commenced December 18, 2024, and the term is for 5 years at an annual cost of $66,906 for a total of $364,692. While this is not fair market value, it complements patient and staff services and escalation at 5% above industry norms. The agreement allows for an annual assessment for fee based on service volume. So I'm always happy to hear your suggestions and comments and any questions. Thank you.
Comments or questions for Dr. Katz? Well, thank you for your report. So let me move on to the committee reports. The committee reports were emailed to you and are in your electronic folders for your review and submission into the record. Are there any questions or comments about the reports? Is there any old or new business from board members to come before this board? So hearing none, the board meeting is adjourned. Thank you.
Thank you.
This meeting is no longer being recorded.